Mental health is something that's part of our lives all the time, but sometimes it's when we're in crisis that we realize what really matters. One of the things that we see, ironically, is that even though during times of crisis like we are now, where you would think that there would be lots of distress and lots of concern, that's true, you also see people coming together. And actually, mental health is the thing that binds us in many ways. It's what enables us to live rich and fulfilling relationships with each other, to be able to function well and to be able to do our jobs properly and to enjoy our hobbies and all of those things. So those things are really important at any time. But actually, a strong and resilient community is able to come together during times of crisis. And we're seeing a lot of that now, actually. We're seeing a lot of people coming together and seeing the best of people in supporting their neighbours and understanding what their responsibilities are to keep the whole community safe and healthy. And that's something you often see, that greater solidarity and mutual support during times of crisis. So I spend most of my time working in the field of international development and working particularly in lower income countries to strengthen their mental health systems and to help people with mental health problems to live flourishing lives in communities. One of the things that we've found in previous crises, like the Ebola crisis in West Africa and others, is that actually doing that work all the time and helping to strengthen those systems and the places that people can go in advance is really important when things become difficult, because people need that. And if you've already done, for example, a lot of training good community health workers, then they're available when people need more care. So that kind of work in advance is really important. One of the things that we're finding now, of course, which as Sheikha mentioned, is that everyone's restricted, that it's more difficult to travel. I've just been told that I should not be also going in to teach or to be doing any international travel, and that makes it more difficult to support people. So it's definitely affected our work, but one of the things that we really focus on is making sure that as much as possible, we continue to support the most vulnerable people. So we know that the great majority of support that people get is from the people around them and from their friends and relatives and neighbours, and that's fine. But my work tends to be with people who have more severe needs, either with mental health problems, psychosocial disabilities, or actually people with all sorts of other disabilities. And for those people, it's really important that we make sure that the systems that they rely on don't fall apart. So we, for example, want to make sure where there are good messages coming from the government or from healthcare providers, they also get to people who can't see and people who can't hear. One of the major shifts for us during a time like this is really making sure that people aren't left behind, that more vulnerable people are as able to benefit from good advice, maybe getting access to testing if that's necessary, or being able to get care at home if they usually do, even during a time of crisis. I think it's really important to remember that there will be people who need more intensive support. For example, people, as Sheikha said, who rely on medication. You know, if people actually really need their medication to stay well, the worst time that you could run out of medication is when you're having all these other worries as well. So that I know that it's can be very difficult, but making sure those medications are available and asking in good time for people to help you to have a good supply, I think is really important. And for those people who are providing services, we really need to be thinking, who are the people who won't be able to easily access the kinds of care that they would normally do so? There's things that we can do as individuals. I think probably we're able to be really important and impactful on the people immediately around us, and sometimes a bit further afield. As I said, we know very well that the great majority of people are actually quite resilient and able to find support and solutions from people around them. I think that's helped if they've been thinking about their well-being. Some of the work you've been doing on hope is important for that, for people to actually learn how to be better at coping. You know, that is something that, as you say, you can teach. But people generally are pretty good at that, and we see the best of people during times of crisis. But there will be some people who don't find that support from people around them, or their anxiety or concerns and worries are more than can be alleviated by people around them. I think it's really important that as we seek help beyond just the people around us, we seek good advice and good information. One of the worries about social media and the wide access to lots of information now is it's not all of very good quality, and people need to be really careful to make sure that they don't expose themselves to lots of very frightening messages, some of which might not even be true or imminent for them. That's the first thing, I think, is not to worry ourselves unnecessarily and get advice from sensible sources. I think where our local communities, or sometimes our, the local services that are available to support us, are not able to do so, in some countries, some additional things have started to be put in place. So, for example, where people might have generally gone to try and see a counsellor or a psychologist or a therapist for more support, then that really needs to start shifting towards some of the helplines, for example, that's in some countries, and many countries are now being put in place. And sometimes they are linked to helplines where people would phone if they have concerns about their general health or in relation to coronavirus. They can also get counselling support and emotional support from there, which is the best thing, of course, that those things are really well integrated, because our emotions are a part of our overall health. So it makes sense for that support to be available from those same sources. Equally, some people are either already linked into specialist mental health services or community mental health services because they use them already, or they need to access that greater level of support because of how anxious and stressed they're feeling because of the coronavirus. And I know that in many countries, there's been a lot of thought that's been put into how those services have been adapted to make them still accessible to people where they can't use the usual processes of coming to an outpatient clinic and sitting together, for example, to wait to be seen, or even to be having group therapies. So I think many of those slightly higher level of sources of care have also started redirecting themselves. But I think there are places that you can find advice in many countries if you need that extra level of support beyond what's available from people around you, or just the kind of counselling you might get from those kinds of helplines. I think the other group of people we need to think about are healthcare staff, and people whose job it is to look after people who might have coronavirus, because they are actually at much higher risk of catching that themselves. It's an infectious disease, and if they're meeting a lot of people all the time, there's a risk that they will get that, and that naturally makes them more anxious, more likely to be concerned about their own well-being. So it's really important for healthcare service providers to make sure they think about their staff, that they give them some time out from frontline work that is very stressful and difficult. Make sure they have opportunities to spend some time at home when they're not, constantly under stress. And we know from what's happened in China and many other places that actually many healthcare workers have made great sacrifices and sometimes got sick themselves. So we really need to make sure that those people in particularly stressful jobs are able to look after their well-being. You're no use to anyone else if you're not well yourself, emotionally or physically, and taking risks isn't a good long-term strategy. So I think the other thing to think, just in closing really, is that this is a temporary situation. It's stressful and it's difficult, and it might be difficult for a while to get the kind of care you really need. but actually we know we're talking about a matter of months. And even more positively, we've never seen the healthcare sector, the pharmaceutical sector kick in so quickly to get really rapid solutions, getting vaccines through more quickly than ever before, antivirals, and certainly getting health systems robust to get ready for maybe if this becomes a permanent part of our human experience of having coronavirus around for a long time. So there is a lot of hope. There are a lot of things that we know are going to change. It's a difficult time, no question, but it won't be forever. And it may be difficult, inconvenient, but we really need to do the right thing for the community, to self-isolate if that's the right thing to do, because it's our responsibility to look after each other, but to know that it's not going to go on forever, and that actually we will be able to get back to our normal lives again.